Thank you very much. Thank you for that introduction. So, as mentioned, I am a compassion fatigue educator as well as a palliative medicine specialist. I trained with Françoise Mathieu. Some of you may have heard of her from Kingston. Yes, I see a couple of nods in the room. If ever you are interested in compassion fatigue, Françoise Mathieu gives a wonderful conference once a year in June. And her website is, I think I've got it on the slide somewhere, compassionfatigue.ca, very easy to remember. So what we're going to talk about is compassion fatigue. I'm going to give you kind of a snapshot of a workshop that we usually give, because the most effective way to talk about compassion fatigue and to discuss it is to do an experiential workshop. Instead of me just standing here telling you, it works much better when you do it that way. So I'm going to give you a snapshot of that workshop today. For those of you who are standing up, there are chairs along here. Feel free to ask questions as we go along. No problem with that. That enriches the talk, so that's all good. First thing I'm going to ask you to do, please, is I think the cameraman is not going to be very happy with me, but what we're going to start with is please stand up. It's only going to be for 2 minutes, Mr. Cameraman, so stand up. So I'm not going to ask you to, we're not singing O Canada, we're not reciting any prayers. All I'm asking you to do, actually, no role playing, I'm just going to ask you to think. So I want you to think about somebody that you know, a colleague that you know who might be a little burned out. What does that look like? Maybe they're anxious. Maybe they're depressed. Maybe they're irritable with their colleagues and others. Maybe they're not showing up for things. Maybe they're late. They're just not themselves. And I want you to think about that person that you work with, that colleague. And I want you to sit down if you do not know someone like this. And then I want you to look around the room. Look around, please. Thank you very much. You can sit down. So the reason why we do that is just to remind us that compassion fatigue and burnout is everywhere. All right? And we don't always approach it. We don't always talk about it. We certainly often don't feel safe to talk about it. But it's there. It's an occupational hazard. And I know there are many different professions in the room. I know the statistics for physicians best. And if you're a physician in this room, you've got a 70% chance of getting burnt out at some point in your career. Okay, 70% chance, that's pretty high. So it behooves us to really talk about this, to have an awareness, to help each other, etc., etc. I'm not going to talk about many more depressing statistics. Here's my objectives. You can read those objectives. Actually, those are the objectives to make it kind of an educational event. But my objective is that, I have 2 objectives. One is that you recognize yourself somewhere in what I say, that you recognize yourself. And my second objective is that you leave this from thinking about one thing that you might do different in your life. One thing. That's it. That's my entire objective. So let's talk about burnout. What is burnout? For those of you who do not know what the definition of burnout is, it's in the top right corner. You might not be able to see it very well. Emotional exhaustion. Emotional exhaustion when you get to that point. Depersonalization and cynicism. You know cynicism? Black humor, a little bit's good, too much, not so good. And a loss of a sense of accomplishment. Those days when you have worked so hard and at the end of the day you feel like you haven't accomplished anything, like you're spinning your wheels, like you're not getting anywhere. Do you know what I mean when I say that? Does that resonate with people? You kind of feel that sometimes. It's okay if you feel one of these or 2 of these once in a while, that's okay. But if on a daily basis you're starting to feel this, then there's a red flag going up. So what does burnout do? Burnout affects professional behaviors. So I was the Director of Faculty Wellness for a while. And in that position, I was sent physicians to see who had unprofessional behavior. And what I can tell you about those physicians is I would say 90% of them with unprofessional behavior, and just think about the people around you that sometimes exhibit unprofessional behavior. So the physicians that came to me, 90% of them with unprofessional behavior, they're not bad, they weren't bad people. They were hurting people. Okay, they were hurting people. They were on the road to burnout. Because burnout, we know, leads to unprofessional behavior. It affects altruism, medical knowledge scores, but look at the last one. So intuitively, we've always thought if you're burnt out, you make more mistakes. Makes sense? The literature now supports that. The literature shows that if you're burnt out or on the way to burnout, you're at risk for making mistakes. Is there anybody in the room who has ever worried about hurting a patient, about making a mistake? Am I the only one that's ever worried? Okay, yeah, thank you. So we know that if we're burnt out, we're at more risk for making mistakes. I also can assume that the people in this room want to be the best that they can be in the job that they do. So I also know that if you're healthcare providers, and I'm making an assumption here, but I'm going to assume that if you're healthcare providers, many of you put yourself second, if not last. Put your jobs, your patients, and the other people in your life first, right? And it is hard sometimes for healthcare professionals to have the permission to actually look after themselves first. But what I'm going to tell you is that if you look after yourself first, you will be better doing what you do. So doesn't it make sense that we look after ourselves? Compassion fatigue is a kind of burnout. It's a little bit different from burnout. It occurs in people in the helping professions. Okay, when you are exposed to difficult stories, to suffering on a daily basis, these are the people that develop compassion fatigue. It's not just healthcare providers. Police officers get compassion fatigue. People in the legal system. So many other people, clergy, many other people. So people in the helping professions get compassion fatigue. It's a deep erosion of our compassion. The difference between compassion fatigue and burnout is when you are burnt out, if you're really burnt out, then you have difficulty working. What happens with compassion fatigue is that you still go to work. You can still get through what you need to get through on a daily basis. The difference is you're not there. You're there physically and you're doing the job, but you are not fully present. And I will tell you that the healing that you do on a daily basis, because this room is full of healers, the healing that you do on a daily basis is not by the physical things that you do. That's part of it. It's not by the physical things that you do. It's not by the prescriptions you write. That's part of it. It's by your presence with people, right? Is your connection with people. That is where your healing, that's where the healing occurs. With compassion fatigue, that's what we miss. That's what we lose. That ability to connect with others. It transforms worldviews. So way in my past, I was a pediatrician. And I worked with child protection for a while. Okay, so, and I was not impacted by that, so I thought. Then I had 3 children. And do you know, I would never let my children be babysat by a young adult male. Interesting. And it wasn't until I started doing this work that I realized that the work that I did in child protection changed my view of the world without me even noticing it. So it transforms our worldview, and not in a positive way. It accumulates over time. So one patient after another, one situation after another, one episode of witnessing suffering after another. And it's evident in helpers' professional and personal life. So when you're at work and you feel this, guess what? You go home and you take it home with you. Okay, you don't leave it at the door, you take it home with you. And it's an occupational hazard. And I think that's really important, because I think we would look at burnout and compassion fatigue differently if we view it as an occupational hazard. You can expect it may happen to you. If you expected that it would happen to you, then we would teach about it differently, we would talk about it differently, we would feel safer to talk about it. So who else suffers when you suffer? Patient care changes, we know that. There's evidence for that. Patient safety, professionalism. Who else? Who in the room has children? Anybody have children? Okay. So when your children were young, maybe your children are young, but if they are, or when your children were young, could they tell if you were stressed out? Yeah, so did they behave differently when you were stressed out? Right? Okay. So other people suffer when we suffer. Your partner or your spouse, if you have one, or your best friend or your dog, can they tell when you're stressed out? Does it impact on them? Yeah, it does. Right? So there is collateral damage when you are not caring for you. Why do I tell you all this? Because we are not good at looking after ourselves. So I'm trying to show you ways where you might think differently about looking after yourself. It's not a selfish act. Imagine if by looking after yourself, caring for yourself, you did better work with patients, you were a better partner, you were a better parent. Imagine the impact that would have on your world. Huge, huge. So it is normal to swing back and forth between these two. We have good days, we have bad days. And learning about compassion, fatigue, and burnout is not about eliminating stress, because it is there. We have to face it. We can change it somewhat, but we cannot take it away, right? And it will always be normal to be up and down. Some days right on your game, and other days just feeling like you'd rather be anywhere else but. That is normal. The question is, can we, when we are presented with those stressful things that we know are going to exist, can we somehow manage them differently? So what do we do? The first, and this is so simple, like this whole lecture is actually really simple. There is no rocket science in this lecture at all. And the first thing that's important is self-awareness. And you know what? If you go to workshops, you read things about self-care, often they jump right into, this is what you can do to help yourself. But you know what health professionals are? They are experts in ignoring the signs of stress. Until we get to the point where we're like completely burnt out. How many of you feel your stress up here in your head somewhere? How many? It's okay, I'm not going to pick you out. You can put your hand up. How many of you feel it across here, across the shoulders? Yeah, okay. How many feel it in here, in your gut? How many feel your stress in there? Okay. How many of you, when you feel it here, or feel it here, or feel it here, how many of you take an Advil or a Tums or a Tylenol or whatever and keep going? How many of you do that? How many of you stop and say, this is one of my key signs of stress? So I need to stop for a second, hold on a second. What is up with me? What's going on in my life right now that I need to do something about? How many of you do that? One. Okay, the star pupil down the back there. The green shirt, I'll point them out. So we have become experts. How many of you have needed to go pee, but you didn't because you were doing something for a patient? All right. How many of you have been hungry, but you didn't eat because you had to do something for a patient? Okay, so all I'm telling you is we have become experts at ignoring our body saying, look after me, slow down and look after me. So we become experts at ignoring it. So if you are an expert at ignoring it, and I tell you all these lovely things to improve your self-care, when are you going to use it? Are you going to use it when you're just at the brink of being burnt out? Or are you going to use it early on? Because you might not even recognize when you're getting stressed. So we're going to talk about self-awareness and warning signs. So what I want you to do is just think about yourself. So in the workshop we have this wonderful time where we can reflect on our own signs and symptoms of stress. I'm going to go through them with you. And what I want you to do is think about yourself and what are your key, like if you were going to tell me, you don't have to tell me, but if you were going to tell me 2 of your key signs of distress, what would it be? Exhaustion, well that's easy. Insomnia, how many people in the room have woken up at 2 or 3 in the morning thinking about something they did or did not do for a patient? Okay, yeah. And you know that happens once in a while. If it happens once in a while, it's okay. If it's happening on a regular basis, then you need to do something about it. Headaches we talked about, increased susceptibility to illness. I think those all make sense. Anger and irritability. How many of you are really pleasant to work with? Like, you've got a smile on your face most of the day. People love to work with you. They can ask you anything. And then when you get home, the first person who crosses your path, wham, they get it. Is there anybody in the room like that? Maybe. Okay. Thanks for sharing that. I was in a workshop with residents. And there was a resident. And when I said this, she put up her hand. She said, you know, I am so lucky. My husband is not in the health professional field at all. But he understands that I have a really stressful job. So when I get home, yes, sometimes I slam him and I get really stressed. And he's so good because he understands that I have a really stressful job. And I said, oh, that's lovely. How long have you been married? She said, 6 months. Whoa. I'm thinking to myself, okay, you know what? 6 months, yeah. Give it a year, 2 years. What do you think is going to happen? So we have to be really mindful. If this is you, when you walk in the door at home, you need to do something different, right? Avoidance of clients. Any of you have a client list, and there's one client that you wish anybody else could see but you today? You know what I mean when I say that? Mm-hmm. Impaired ability to make decisions. Have you ever had a day where what you're doing is kind of like what you do most days, and you just can't make a decision? You say, why can't I make a decision on this? I do this all the time. Do you know what I mean when I say that? Yeah, okay. Problems in personal relationships, that explains itself. Compromised care of clients, that is what we all do not want to happen, right? None of us want that to happen, right? Okay. Distancing, negative self-image, okay, these all make sense. Reduced ability to feel sympathy. Have you ever been in a position where you hear a story and you know the story is not good and yet you don't feel anything? I don't know, maybe you're aware of that. That's another example. So these are all about examples. So think about yourself. Remember, we're thinking about you. You're thinking about you. What are your key signs and symptoms of distress? Problems with intimacy. Intrusive imagery, that might be that 2 or 3 in the morning that we just talked about. Anxiety, hypersensitivity to emotional stimuli, which seems opposite to insensitivity, which they are. People exhibit this differently sometimes. Hypersensitivity is you're in a moment and you think, oh my gosh, if I don't leave this situation, I think I might cry, or I might just blow up, or whatever. And insensitivity is that moment when you hear that story and you don't feel anything. And you think, wow, this is a bad story and I don't feel anything. Increased sense of personal vulnerability, loss of hope. And the key one on this slide is the difficulty separating personal and professional lives. So when you're stressed out work and you're feeling a little bit burned out, sometimes we can, lodge it somewhere on our way home and forget it. With compassion fatigue, you can't do that. Compassion fatigue follows you everywhere you go. It follows you back home. It follows you into your friendships, into your relationship with your partner, with your relationship with your kids. That is why it's so important to be aware of it and to do something about it. So these are the signs and symptoms. So we have to start here. Because if you don't know your early signs and symptoms of distress and burnout and compassion fatigue, you might not necessarily change anything in your life right now. And by the time you get to the point of burnout, you've lost a lot. So the other thing we do in the workshop is we talk about what part of your life is causing stress. And I'll give you an example of why we do this. We had a nurse come into a workshop, and she walked in and she said, oh, I'm so glad to be here. I am exhausted. My job is stressful. I want to quit. And then we get to this part of the workshop. And we go through 5 domains of life. And we look at the potential stressors in each of those domains. And we kind of get a sense of where the stress is in our lives. So after we did this, and I'm going to go through it with you, but after we did this, the nurse put up her hand and said, I'd like to share my story. So this is her story. She has a stressful job. So she tends her job every day. She works full time. At the end of her day, she goes to the long-term care facility where her mother lives. She feeds her mother dinner. She talks to the staff. She does what she needs to do to help her mother out. Then she goes home to attend to her own family and herself. She has 3 siblings in the same town who don't do any of that. So at the end of this, when we talked about where her stress lay, she said, you know what? I realize I don't need to quit my job. I need to quit my family. But the point is that sometimes when we feel stress, we don't actually know where exactly the majority of it is coming from. So again, it's that self-awareness. So I'm just going to go through, I'm going to apologize in advance for 5 really boring slides. Oh, not that one, the next one, next 5. Because I'm going to go through a list of some of the things we talk about in terms of self-awareness, where are the key areas of stress in your life. And they're under these topics: relationships, environment, body, mind, spirit, work, and money. And there are many other domains to you. I'm not trying to simplify you down into these 5, but it certainly helps in terms of determining where your stress is. People in my life who drain energy, think about that. So when we're going through these, again, this is about self-awareness. Think about yourself. Think about the areas that may cause stress. Because if you know those areas, then you may be able to create a strategy to help you in those specific areas. So people who drain energy, unreturned phone calls, emails, or letters. Oh my gosh, that's a big one for me. Unresolved conflict with a family member. Few quality friendships, lack of a romantic partner. There is someone I need to forgive. Think about your own life. I lack a readily available support system. So those are just some of the topics under relationship. Environment. My car is in need of cleaning. My wardrobe needs updating. I need to live somewhere else. My house is not decorated well. My house is cluttered. Now, when you look at these are not all going to be meaningful to everybody, right? So when we do in the workshop, someone said, yeah, my house is really cluttered, but I don't care. Like, it doesn't bother me. So, okay, that's fine. If it doesn't bother you, that's okay. Whereas someone else said, my house is really cluttered. Oh my gosh, maybe if I declutter, I would feel better. And I don't know about you, but when I'm at work and I have a really stressful day, you know what I do? The first thing I do is go to my office and clean off my desk. Does that make sense? Okay, other people have experienced that. And somehow when I clean off my desk, and my desk is uncluttered, the world seems a little easier to take. Right? So for me, that became one of my stress relievers, cleaning off my desk. Body, mind, spirit. I had a resident in a workshop, and when we got to this part, and usually at the end of the workshop, we asked people, were there any surprises here in terms of what areas of your life were causing stress? And he put his hand up and he said, wow, he said, he was a second-year resident. He wrote his letter to get into medical school. He titled it basically Body, Mind, and Spirit. And he wrote this beautiful letter about how, as a physician, he was going to attend to body, mind, and spirit of his patients. And in being a holistic physician, he was going to attend to body, mind, and spirit for himself. And now he's a second-year resident, so 6 years later, he said, you know where all my check marks are? Body, mind, and spirit. All the check marks of what's causing him stress. So somehow he forgot, and that's what we do, right? We get super busy, and we forget. We forget about ourselves. We forget about what we need to do, and that's what all his check marks were. So he knew exactly what he had to do when he left that workshop. He knew exactly where he had to focus his thoughts and changes. Work is usually an easy one in terms of checking off the things that are stressful. Avoiding confrontations related to work. Anybody feel that? I don't know your group, so I have no inner knowledge. I'm just bringing it up. Yeah, that all makes sense. And money, I saw a physician, when I was in the faculty wellness office, I saw a physician who hadn't filed taxes in 3 years. Can you believe that? That was a big source of stress. Spend more money than I earned. Yeah, okay, so that all makes sense. So again, relationships, environment, body, mind, spirit, work, money, these are just possibilities of areas of distress. And again, if we don't look at the individual areas, sometimes we feel this global stress and we don't know what to do with it. And we decide that we're going to do yoga to help out, which is really good, by the way, but yoga to help out. Or we're going to, excuse me, do something else that's actually a good strategy for stress relief. But if we're not aware of all the details of where the stress comes from, sometimes we don't target excuse me, target our approach the way we should. So what has been shown to work? Anybody see on this screen that they've never heard of before? No, guess what? No rocket science here, right? So it's not about, this slide's not about telling you something you don't know. It's about reminding you. Okay, it's about reminding you. I am a stickler for getting enough sleep. I drive my kids nuts when it's past their bedtime. Because personally, that for me, getting enough sleep makes the world far easier to handle. But that's probably one of the first things that we tend to let go, right? Let's see, let's go down through here. Debriefing. Do you have a process for debriefing in your division? No? Yes? Just some shakes or nods. No? Okay, debriefing. Lots of literature on debriefing. Lots of literature on debriefing. Just having a process. Now I know we informally do it. We get in little clumps and we say, oh my gosh, can you believe that happened? And we do it informally. But there's lots of evidence that shows that formal debriefing actually decreases the stress at work quite significantly. So you might want to think about that if you've been thinking about it. I'm going to talk about a few strategies that have a lot of evidence for stress relief. Mindfulness. Anybody in the room have a mindfulness practice? A couple of people. Anybody in the room, apart from those people, know what mindfulness is? Yeah, a few people. They're all in the back, surprisingly enough. Okay, I don't know why, but anyway, so do you know what's really interesting? I can tell you something really interesting. Of all the things that, in this whole group, if we were to list all the things that we know as a group for stress reduction, we come up with a huge list. It would be enormous. And when I give a talk and I ask who knows what mindfulness is, most of the room doesn't even know what it is. There are thousands of papers written about mindfulness as stress relief. No matter what you tell me that you do for stress relief, it will not have the same evidence base as mindfulness. Isn't that interesting? Mindfulness has the largest evidence base of anything you can possibly tell me for stress relief, and we don't even know what it is. Let me give you an example of being mindful. Think about your last shower. Don't have to tell detail, just think about your last shower. I was in a group of surgeons, and some of them were in Greens, and I said, think about your last shower. And a few of them I used to say, think about your shower this morning. So a few of them put up their hands and said, we didn't shower this morning. Okay, so let me reword that. Think about your last shower. Okay, your last shower, whenever that was. What was it like? Did you stand there thinking, oh my gosh, I'm going to be late. What am I going to have for supper tonight? Oh, the weekend's coming. I wonder what I'm going to do. Oh, I got to get the groceries on the way home. Was that your shower? Or was this your shower? Oh, this feels so good. I feel the heat of the water. I can feel the water dripping down my body onto the tops of my feet. And the heat and the steam and this feels. Okay, so I just got lost there for a second. So do you see what I mean by mindful? When you ate your breakfast, for those of you who ate breakfast this morning, did you shovel it in because you had to get off to this talk? Or did you really taste it? Really experience it? Really feel the textures in your mouth? Okay, so that's what mindfulness is. And what we know is that 8 to 10 minutes of mindfulness a day decreases stress-related hormones as measured. 8 to 10 minutes of mindfulness a day decreases stress-related hormones. Mindfulness changes your functional MRI so that your happy places light up and your stress places go down. Functional MRIs. There is tons of literature on mindfulness. We could do a mindfulness exercise. What time is it? Yeah, we got time. Okay, let's do a mindfulness exercise. Now, it's going to be hard for this people standing up. So you're just going to have to bear with me. It might not be the same experience for you. I want you to get comfy in your chairs. I want you to put 2 feet on the floor. And I want you to just move your bum around, do whatever you got to do to get comfy in that chair. Sorry for those standing up. And I'm just going to take you through a body scan. Okay, so I'm just going to take you from your head to your feet. Just listen to my voice and notice what I ask you to notice. If you are comfortable, close your eyes. If you're not comfortable to close your eyes, then just gaze gently at something in front of you. So we are going to start with deep breath. I want you to take a deep breath in through your nose. Let your belly expand. Breathe right into your gut. Deep and slow breath and let it out. So we're going to take a couple of these deep breaths. Deep, relaxing breaths. In through your nose, deep as you can, and then let it out. And then we're going to think about your head. Your head and your neck, your face, your forehead. Is your brow furrowed or soft? Your eyes, do they feel relaxed? Down to your jaw, is your jaw tense? Is it relaxed? And all the while that you hear me, I want you to continue taking those deep, relaxing breaths. Now we're going to think about our neck and our shoulders. Are there any knots? Is there any tension? Are we holding our shoulders up or are they relaxed? Down through your arms, to your elbows, to your hands. Notice where your hands are. Are they on your lap? Are they gently touching? All the while taking deep breaths, deep, slow, long breaths. And we'll come back to your shoulders and go down your back. Feel if there's any place that's sore. Feel if there's any knots. Feel your back against the back of the chair if you're sitting down. Feel your bum on the seat if you're sitting down. And then we're going to travel out to your knees, down to your feet. Feel the weight of your feet on the floor. Feel the feeling of your feet in your shoes. And all the while, taking deep breaths. And with your next breath, I ask you to breathe into the spot. If you have had or have discovered a sore spot, a tight spot, breathe right into that spot. With every deep breath, breathe right into that spot. Imagine that breath. Imagine that relaxing breath going right into that spot. And then we'll take a few more of those deep breaths. And when you're ready, open your eyes. Everybody awake? Did anybody feel any bit of relaxation with that? Yeah, isn't that relaxing? That's mindful. Now, some of you may be thinking about the clinic that starts at 9 o'clock, or great plans for the weekend. But if you were able to stay in that moment, see how you are fully present. That's what mindfulness is, being fully present in this moment. It doesn't mean meditating about a beach somewhere that you'd like to be, where we'd all like to be. It's not about that. It's about being fully present in this moment, doing whatever you are doing. Are there any competitive athletes in the group? Because if competitive athletes are pretty mindful, right? You've got to be fully present in that moment. So it's about being focused. It's about being fully present in that moment. And it's also about being non-judgmental. So if your brain was, or your mind did wander off to the clinic or the grocery list or the weekend plans, that's okay. That's okay. If you had any relaxation with that, just imagine that was just 1-2 minutes in the middle of this, a room full of people. Mindfulness has been shown to decrease stress-related hormones, change your functional MRI. If you're more interested in mindfulness, John Kabat-Zinn is a lot of stuff on YouTube. You may have read some of his books. He's basically the person who brought mindfulness from the Eastern religious traditions to North America. Okay. Any questions about that? So how do we do mindfulness? Learn how to breathe. You've probably heard about that. Breathing techniques for relaxation, that's very mindful and can really decrease stress. Body scan is what we just did. Body scan is great. Anybody with insomnia in the room? Difficulty sleeping? Yeah, okay, body scan is fabulous to go to bed. Yoga and day-to-day activities. So when you're practicing mindfulness, there was in a workshop, one woman told us about how she practices mindfulness. She does it when she's washing her dishes. So when she's washing the dishes, she's not thinking about all the things she has to do this evening. She is feeling her hands in the water. She's paying attention to the bubbles. She's smelling the smell of the soap. She's fully present in that moment. Isn't that hokey? Yeah, it sounds kind of hokey, but I'm telling you, this is the most evidence. If you can get yourself in a mindful place 8 to 10 minutes a day, it will decrease your stress-related hormones and therefore decrease your stress. And there's mindfulness-based stress reduction programs offered in Ottawa at some of the yoga places. Anybody write out their stress? Anybody keep a journal or write? So narrative, there's tons of evidence about narrative for stress relief, tons of evidence. Okay, so what happens when you write something down? When you write something, it slows down your thinking processes to the speed of how fast you write. And when you do that, it enables your brain to process what you're doing. So when you write it, what you've got written doesn't necessarily matter. It doesn't have to be pretty or flowery or intelligent sounding. The act of writing it is what slows down your mental processes to enable you to process what you're dealing with. For me, if I had to write a journal, I would go insane. It would drive me crazy. But I'm telling you, at the most stressful points in my life, I have written out my stress. Just free flow. What's been going on, and it is very helpful. You don't have to read it again, you don't have to keep it, you can burn it or throw it away or do whatever you want. It's the actual process of writing. So keep that in mind for those of you who have an interest in doing that, who may have done it in the past, that there's lots of evidence for in the literature. Gratitude practice, more evidence coming up for this, eh? So we're hearing about this more and more, about gratitude. What does gratitude do? Gratitude changes how you think. So it helps us to think more positively when we have a practice of gratitude. We'll talk about resilience and how that impacts on resilience. So here's a gratitude practice you might want to try. Wake up every morning and think of something, the first thing you think of when you wake up, something that you're grateful for. Thank God, thank the universe, thank no one in particular, just thank you. Whatever it is that works for you. And then before you go to bed at night, do it again. Thank you for. And if you do that for 30 days, I guarantee you if you do that for 30 days, you will feel different. Resilience. I'm sure we all know what resilience is. Resilience is the ability to bounce back when you're stressed or distressed. Resilient people are not stress-free people. Resilient people have stress and they go down, but then they have this ability to bounce back. Are there resilient people in the room? Just a couple. Okay. Do you think you can increase your resilience? How would you increase your resilience? You kind of got to know what the components of it are, right? If you're going to change something, you have to know something about it. What can you change? So I'm going to give you 3 very basic elements of resilience. You can choose one of these to change. If you change one of these in a positive way, you will increase your resilience. Positive emotion and attitude. When you're around people who are positive, don't you feel better? Isn't that true? When you're around people who are negative, don't you feel worse? Okay. So do you know that the literature shows that when you're around people who are positive, your measured levels of resilience goes up? Isn't that interesting? So it's not just about yourself, it's also about who you're with. But positive emotion and attitude, the gratitude thing can do that. Mindfulness can help do that. Social support. How many of you have given up friendships, or how many of you have let friendships go because you are just too busy? Anybody? Got relationships in your life that you don't attend to as well as you could because you're too busy? Well, I'm going to tell you that this is one of the key pillars. Let's call these pillars. They're like 3 legs of a 3-legged stool. Okay, you knock one out and the stool goes over, but if you support all 3 of them, the stool is strong. Social support. So I'm telling you now, for those of you who have not invested in those relationships, if they are positive relationships, you might want to rethink that as a strategy. Because when you have good social support and when you're around people who lift you, your resilience goes up. So think about that. Meaning making. How many of you at the end of the day look back and see what great work you do? Is there anybody in the room who does that? Yeah, okay. This woman down here is awesome. She's raised her hand for a lot of great things.
I started doing all those things because I had to.
Yeah, because you had to. Yeah. And, right, and sometimes we wait till we get to the point where we have to do it now or something really bad's going to happen. So what I'm suggesting is maybe we should just start doing it earlier, before that point happens, right? So meaning making, I have a resident who has a wooden box, and in this box she keeps thank you notes. She keeps little snippets of stories in which she has done something good for somebody in the run of the day. And she keeps them in this box. And on the days that she feels like the worst resident that ever walked the halls of the Ottawa Hospital, or the worst whatever, you know what I'm talking about, on those days she opens her box, she takes this out and says, wow, I really do good work. I do good work. Okay? And that is meaning making. That is finding meaning in the work she does, and that is one of the pillars of resilience. If you increase any of these, you will increase your resilience. So what I will suggest to you, if you're looking for a way of increasing meaning making, at the end of your day, look back. Look back at, even if it's just one patient that you know you did something good for. And something good for might be just listening to a person who really needed to be listened to. We do great things every single day. It is amazing. It is amazing how much good you do in the run of a day, but if you're not mindful of it, it doesn't have the same impact. If you can be mindful of it, it has a big impact on meaning making. Any questions about that? Relationships are key. So enhancing meaning, we talked about that. Self-doubt makes us forget what we're capable of doing. And we all have elements of that, right? We all have days where we doubt ourselves, doubt our abilities, right? Doubt ourselves in many ways. Okay, strategies for wellness, this is a whole bunch of things. I'm going to pick out a few things. Under physical, choose one thing. So what I would suggest to you is, if you want to do something for yourself, if you say, well, I'm going to sleep better and exercise 5 days a week and eat better and guess what? You're going to be overwhelmed. And you're not going to do it. You may have tried it before. What you need to do is choose one thing, one small doable thing, one thing. Because once you do one thing and do it well, the next thing will follow, right? Something else will come once you start this kind of practice. Addressing old hurts and traumas, every one of us in this room has a story. And some of our stories are more difficult than others. And sometimes those stories get buried down deep, and sometimes they get re-triggered in the work that we do. So why don't you think about that? That's not something we can address here, but it may be something that's relevant to you, and maybe something that you need to look a little bit deeper into. Addressing grief. We see grieving people all the time. In geriatrics, you're seeing people with a number of losses, right? They've lost partners. They've lost their ability to be independent. They've lost their health. Many, many, many losses. So they're experiencing grief on an ongoing basis, and we grieve too. And sometimes grief, we don't give a name to it, and we don't become mindful of it in our own lives. Okay, so I'm just saying, if there's issues around grief, then maybe that's something you have to deal with. The debriefing we talked about. So self-care, some pearls. This painting, this is a painting. It was painted by a second-year medical student. And the second-year medical student was an artist before she became a medical student. And art was a way she expressed herself, and she managed her stress through her art, and it was very, very pivotal in her life. And when she became a medical student, she decided she was going to put aside the art for now, because she was going to be the best medical student she could be. So she was going to really focus on studying and doing all the things she needed to do to be a good medical student. And by second year, she thought to herself, I don't like the way I am. I don't like the life that I'm living. If this is what I have to do to be a good medical student and eventually a good physician, I'm done. And that Friday, she went to a lecture, and just look at the left side of the screen. This was what was on the screen at the end of that lecture. The heart must first pump blood to itself. Shapiro is a surgeon. The heart must first pump blood to itself. Do you get it? The heart beats. Who does it serve first? The kidneys? No. The brain? No. It serves itself first, and then it serves the rest of the body. So the message is, if we are going to be strong, we need to serve ourselves first, and then serve those around us. And so that medical student saw this and said, you're absolutely right. That weekend she put away her books, she took out her paints, and she painted this self-portrait of herself, looking down at her heart, to remind herself that the heart must first pump blood to itself. We need to look after ourselves first. You know what's really funny? I actually gave a workshop and had this slide in to a bunch of cardiac surgeons. So I put up this slide, and I'm about to launch into my story about the medical student. They're all looking at the slide like this. No, it's not anatomically correct. It's okay. A medical student did it. Anyway, it was kind of funny. So that's just a little reminder to you. The heart must first pump blood to itself. I was in a lecture. Someone came up to me at the end of the lecture, and they said to me, the thing that I'm taking away from this lecture, the thing that really struck me the most, is that it's okay to be average. Wow. Because I was in a room with a bunch of perfectionists. And I may be in a room now with a lot of perfectionists. I'm one. And I've had to struggle with that. And perfectionism is great for many things, right? Getting our work done, moving us places, it's great. But sometimes it can have a negative effect. And maybe if you're a perfectionist, you can see that in your own life. Remind yourself it's okay not to be perfect. Okay, I have a question. The next slide has a question. And do you get, some of you are on Facebook and you get emails. So do you ever get on your Facebook account or emails, 7 ways to have a better relationship, 10 things to do to be better at this? Do you know what I'm talking about? You know those? Okay, so someone sent me one, and it was so perfect in its simplicity that I'm going to show it to you. And it's a single question. So if your life isn't where you want it to be, like if things just don't feel right, then you look at the elements of your life and you ask yourself this one simple question. Am I happy? In my relationship, am I happy? You know, it's funny because I'll give a relationship as an example. You know, he's got the right job and the right education level, and you know, we have a lot in common, and we've got all these, but am I happy? No. Then that's not the relationship to be in. Think about your job. Well, you know, it pays the right amount. It's in keeping with my teaching and learning and education, and you know, I kind of like the people I work with, but am I happy? Isn't that simple? So when you distill it down to that, if you're not happy, then maybe you have to think about changing something. And sometimes we get stuck in where we are and we're afraid to change. It takes a lot of courage to change. But this is a simple question which I think is actually quite profound. You don't have to see the whole staircase to take the first step. What that means is that if your life is not the way you want it to be, just make a change. You don't have to know what it's going to look like 5 years from now. I mean, it would be great, and it's okay to make a 5-year plan. That's okay. But you don't have to know it to be able to make a change now, to do something just a little different. And this is the beauty of it. Right? This is the beauty of it. I love this because the choice is yours. And the reason why I love this is because if you're not happy with your life the way it is, I mean, if you are perfectly happy with your life, that is awesome. You're one of the rare few. If you're not happy, it's up to you. You can leave here today and do nothing different. And that's okay. If that's where you're at, that's okay. Or you can leave here today and say, yeah, okay, there's one thing I need to think about, and maybe there's one thing I can change or do differently. And the choice is yours. There's no one else's fault. There's no one else to blame. The choice is yours. And I'm done. Thank you very much.